Hi, thanks for taking the time to visit us at the Center for School Behavioral Health at Mental Health America of Greater Houston. The center's mission is to improve the prevention, early identification, intervention, and treatment of behavioral health issues among students. We do this by providing training modules, lesson plans, and activities that are designed to build a school's internal capacity to infuse mental health into the campus culture. The center currently works with 30 school districts and more than 80 organizations in the greater Houston community. The purpose of this training is to equip the audience to understand some of the commonly utilized crisis terminology, recognize the behaviors or feelings that you or your youth may be experiencing, and strategies for moving forward amidst the current crisis. There are two professional development specialists on our team who are responsible for designing and facilitating our trainings to student-facing professionals. Sharifa Charles and myself, Nicole Milton. I'm excited to facilitate this training opportunity for you because I believe in the work that we do at the center, and it is my hope that more school districts will prioritize mental and behavioral health of their students. I am a former science teacher, I'm a true people person, and I'm a conservative thrill seeker, which means I'm scared to death of heights, but I love the thrill of a roller coaster. My personal hope is that Cedar Point in Sandusky, Ohio will open up soon. Whenever we can get back out there, I can't wait to visit. Here's where we're heading during this video. We're going to define quarantine, isolation, and social distancing, the impact of isolation on mental health for the adult and for the youth, recognize potential behaviors that may result from the lack of academic, social, and physical stimulation, and determine what strategies to use to create a new normal for you and your youth during a crisis. Three terms that we have heard used quite often and sometimes interchangeably are social distancing, quarantine or self-quarantine, and isolation. Social distancing is creating space so those that are sick will not impact those who are well. Quarantine or self-quarantine is designed to keep you from contracting the virus, and isolation refers to the ill who are distancing themselves from preventing the spread of the disease. While these measures are being utilized to keep us safe physically, we cannot neglect the impact that this may be having on our mental health. We live in an information-rich world with easy access to the latest statistics about the current COVID-19 pandemic. Correct information is a vital tool, but the gift and curse of our information access is that we can see how others are impacted and potentially internalize their attitudes and feelings. Fear about a disease can be overwhelming and cause strong emotions, and we realize this is not just in our respective areas, but also happening worldwide. Some typical reactions to a crisis situation are anxiety, frustration, boredom, and for some, anger. Anxiety could look like worry or concern that would impede your ability to do your daily activities or the way that you are interacting socially. Frustration is holding back a feeling or emotion. The quickest way to alleviate frustration is to identify the underlying feelings. For example, I may say that I'm frustrated, but I'm frustrated because I could be angry, I could be fearful, or I could fear being embarrassed or sad. We're not certain how long we will face these conditions, and during this time of distancing, quarantine, isolation, feelings of anxiety, depression, and helplessness can increase, especially since humans are social beings. We also want to consider those that have pre-existing mental health conditions should continue with their treatment and be aware of new or worsening symptoms. For most children and adolescents, school is the most important social arena. School absence for prolonged periods results in limited interactions with other children and adolescents, hence the need for some type of routine in the home. Now, the routine doesn't have to be static and all, and it's actually recommended that it's not static, but just that there is a routine. When considering the teens in your home or teens that you may know, their brains have not fully formed, and so this may lead to acting without the ability to weigh long-term outcomes. For example, they may be resistant to social distancing without realizing that they could be compromising their health and the health of others. Some possible behaviors you may see your youth or teens exhibiting as a result of not being in a socially stimulated environment, such as school, excessive crying, irritability and acting out, excessive worry or sadness, difficulty paying attention, watching their sleeping or eating habits. Having one or two signs or symptoms does not automatically mean that someone has a mental health concern. So when should you be concerned? This slide goes through the 4 hows of how and when to be concerned. So when you notice a cluster of changes in students functioning, so consider the 4 hows. How many signs or symptoms are you seeing? How is the person's behavior different? How bad is it? Thinking about the impact of it and how long has it been going on? If the answers to these 4 hows are beginning to be yes, then you want to consider the best approach to help that person. The number one question we get most often is, what can I do? Number one is to do what is best for you and your family. We acknowledge that we have been experiencing quarantine and being inside for quite a while. So don't stress or feel like you need to do one or all of these at all. The most important thing is to continue to do what has been best for your family and their self-care. So looking after your mental, physical, and emotional health. Other things that you can do are to limit your media consumption and the news, having conversations in the family, asking how the kids see parents handling it, how are you handling it, creating a routine with your family, and prioritizing your health. Kids can take virtual field trips, create a routine with their parents. We're all going to take a break at blah, blah, blah time. So making sure that there's academic, social, and physical activities for the kids and for the parents. Social time with families. If this is a lot of screen time for students, maybe staying active either around the house or outside. So doing puzzles, building something, creating art, learning a new dance, starting meditation. Some resources I would like to highlight for activity ideas and or conversation starters. So Riverside Health System and the Los Angeles Times both had really good lists of what families can do during this quarantine time. And National Children's Organization had lots of tips on how to talk to your kids or youth about their mental health and how they're handling all of this. So we want to thank you for taking the time to view this video, Coping During COVID. Please complete our course survey at www.surveymonkey.com/r/COVID cope. If you have any concerns or inquiries for the Center for School Behavioral Health, please feel free to contact us at csbhinfo@mhahouston.org. Have a great rest of your day. Bye-bye.